short walk to and from the clinic as you're going back and forth from your clinic time to hospital time. So we're very proud of that walk. Also, our building, brand new, we just moved in May of 2020. It is a little under 15,000 square feet. It is 24 exam rooms, 2 of those rooms being treatment rooms, a little bit larger. One of the exam rooms is actually fully dedicated to therapy services. We're very, very excited about that for this community. We have x-ray capabilities now here in our building, and we also have a full lab that takes care of all point of care testing needs. So let's take a walk inside and we'll look at our waiting room. So this is our front lobby. As you can see, very spacious, very bright. We do have our seating arranged per social distancing guidelines for now. This is our front check-in area. The girls here up front, they handle all of our check-in, check-out needs, all of our scheduling of all of our different services that we provide. Anything regarding medical records. They're the first point of contact with our patients, last point of contact with our patients as they're leaving. Very important roles. All right, next we're going to take a look at one of our conference rooms. We have many plans for this room. So currently we're using this room for meetings within our clinic, but we are actually in the middle of starting a centering program for our pregnant moms. So we'll be using this room for that service. We also plan to use this room for various support groups for our community, and just really expanding services for our community and being able to do that here in the front space of the clinic. Easy access in and out for our patients.
Hey, I'm Aaron Zeller, and I'm going to take you from the waiting room back into our clinical space. So if you follow me, our building was designed with a little extra waiting room space, or excuse me, front office space back here. And then right beyond that is some clean utility rooms and a med room where vaccines and other medicines are stored. And then right back here is one of our nurses' stations. We designed this as an open space where both nurses and then providers could sit and get work done and collaborate really closely. And each nursing station serves 2 pods. We have 2 total nurses' stations, 1 on each side of the building, and 2 pods on each side of the building. 4 pods total, 6 exam rooms per pod, with 2 procedure rooms in the back pods. Our 4 pod names are Hartwell, Issaquena, Jocassee, and Keowee, named after the lakes and waterfalls in our county. 3 of the pods are going to be teen pods. And this is one of the a representative exam room. This is Jocassee 1. We decided to go with a team-based model of care where each resident has a panel of patients and then is on a team. So if you're a resident here, you'll be on either a Jocassee, Keowee, or Hartwell team. And then you will share that your patients with an attending and then also with a couple other of your residency colleagues, and that way you'll be able to take great care of your patients and then also be able to take great care of their patients on a team.
All right, so once you have your assignments for the day, our residents will round or pre-round with their nursing staff and their team. And so that's a chance to look over your schedule for the half day, kind of figure out what needs to be done up front to make clinic more efficient. And then the residents will see the patients on their own and come find their preceptor for that half day. We have a faculty assigned every half day to a certain number of residents. And you can use this precepting room here to talk about the case without the patient overhearing things, but you're close enough that everybody can get up and go see the patient together. And our first year residents, everyone's going to be seen for the first few months just to make sure everyone's comfortable seeing patients on their own. And then after that, we can let residents a little more freedom and see patients and come when they need help from the preceptor.
Hi, I'm Dr. Quick, and I'm going to be showing you some of the other resources that we have on site. Come with me. So here you can see that we have a radiology suite, including an x-ray machine. This allows our patients to get in-time x-rays without having to go over to the hospital. As you can see, we are still setting things up, but when this is up and running, we'll be able to tell our patients with fairly good confidence whether they have pneumonia or a broken foot, but we will be sending our images over to the hospital radiologist for confirmation. If you follow me this way, I'm going to show you our lactation room, which is going to be used for patients, residents, staff, and really anyone in the community. We are hoping to provide lactation services with a lactation nurse who will come in a few times a week to meet with patients. And around this corner, we have an on-site laboratory, and we'll be able to do some point-of-care testing so you can have in-time lab results, and anything that takes a little bit longer to process will be sent over the hospital.
Hey y'all, I'm Dr. Thomas. I'm one of the core faculty here, and I am in charge of medical student education, and I am excited to show you our specialty pod today, so come follow me. So this is our specialty pod, also known as the Issaquena pod. This is where we do all of our procedures and where we also have specialty clinics. Some of our specialty clinics include Osteopathic Manipulative Treatment Clinic, or OMT clinic. We also have an in-house pediatrician who collaborates with child and adolescent psychiatry to do telehealth provision for patients here. And then this is where we would do all of our women's health procedures like IUD insertion and removal, Nexplanon insertion and removal, colposcopy, all of those sorts of procedures. We also do a ton of MSK procedures like joint injections, skin procedures, biopsies, and the list goes on and on. There's so much to go over. I just want to kind of show you guys this pod and show you our rooms. Follow me. So this first room is going to be our OMT room, which I'm super excited about. So I am a DO, and I graduated from VCOM Carolinas campus, and I do practice OMT. We do 40-minute OMT procedure visits, and we have adjustable tables, which is awesome because it allows us to accommodate more patients of different sizes. And whether or not you're a DO or an MD, you will learn OMT, some hands-on skills to help treat chronic pain while you're here, which I think is really cool. Let me show you our psychiatrist area and our licensed professional counselor office. So we are really unique as a program in that we have 2 licensed professional counselors on staff, and we also have a collaborative care model, which is unique. We're one of the only programs in the country with an embedded collaborative care model where we get patients plugged into counseling really quickly, and we collaborate with Greer's psychiatry residency program to help get those patients seen. And then let me show you our procedure room, which is where we do the bulk of point of care ultrasound. That's where we would do paracenteses and things like that as well. So come on in. This is our procedure room. As you can see, it's very spacious. Like I said, this is where we would do more in-depth procedures like paracenteses, some of the more in-depth skin procedures that you would need to do, or suturing for lacerations and things. This is where we would also do point-of-care ultrasound exams, which I'm excited about. I'm in charge of that curricula here, and we have 2 butterflies, which are these handheld ultrasounds for the office, and then 1 for the hospital, and we have a sauna site here as well. So we got some really cool stuff going on this pod. I'm excited that I got to show you all around. So thank you guys for your time.
Hello, I'm Dr. Brandon Watson. I'm one of the interns here at the Seneca Family Medicine Program. Just going to be showing you around, and right now we're starting on the back hallway. This is all the preceptor rooms, This is where they're doing their kind of office work, but usually they have an open door policy where you can stop by, talk to them if you have any questions. They're more than happy to help. And as we go this way, I'm going to show you our workroom. This is pretty much our kind of private resident space. We have desks set up, some where they're more secluded if you prefer that, some more, open view with a window, plenty of places to store, anything that you want. This is pretty much where all the magic happens, where we come in to write our notes and just, go over everything with the patient for the day. Connected to it is our break room. This is where you can come in, store any food, drinks that you want to store. A lot of times we'll have where we kind of celebrate people's birthdays that are kind of sharing within the month, have a cake, maybe just kind of everybody say happy birthday to everybody. And sometimes this is where everybody just kind of congregates right before we actually start didactics, which we're actually going to the didactic room now. This is one of our larger conference rooms. Every Wednesday in the afternoon, usually from 12 to 5 or 12:30 to 5:30, we will meet for didactics. They're usually 45 minutes to hour-long segments where we'll be going over multiple topics. Sometimes we'll have a guest lecturer come by and do a special presentation, whether it be cardiology, sports medicine, something like that. And that time is always guaranteed to you and dedicated to you to learn. Now, if you are coming off of a 24-hour call, you will not be expected to stay for didactics that day. It will be counted as part of your allotted didactics that you're allowed to miss. And so that will be every Wednesday. And then some Wednesdays we will meet in Greenville where we'll have shared didactics with the Greer program and the Greenville Family Medicine program.